Dear participants, on behalf of the Italian Ministry of Health, I would like to welcome you to the second annual conference of the Transforming Health and Care Systems Partnership, and thank you for your participation. I regret not being able to join you in person since other commitments keep me in Rome. However, I am confident that the Ministry is well represented by our coordinating team. I would like to thank the European Commission, WHO, the European Observatory on Health Systems and Policies, and all the distinguished speakers who will participate for what will undoubtedly be an inspiring and enriching exchange. The Italian Ministry of Health is honored to coordinate this important partnership at the European level, reaffirming its long-standing commitment to health research funding and to strengthening the European research area. The Transforming Health and the Care System Partnership is the result of a long journey during which teamwork and collaboration between various sectors and past projects have played a crucial role. Public health experts and funding institutions, both at the national and European levels and beyond, have worked together to achieve this remarkable milestone and advance cooperation in health research. This is the first joint funding initiative focused on research in health service and systems, a groundbreaking achievement at both the national and the EU level, considering the limited attention this field has received in previous funding programs. It underscores the importance of public health research in providing the scientific foundation needed to support the development and the monitoring of health policies and to translate innovation into health and care systems. 2 years into the partnership and following the first reporting period, we can proudly state that many strides have already been made toward building a more efficient, resilient and patient-centered health and care systems. However, much work remains, and these ambitious goals can only be achieved through coordinated and collaborative efforts among all the involved stakeholders. The focus of this second conference will be on translating theoretical concepts and research findings into practice, considering the perspective of major stakeholders such as healthcare professionals, patients, academia and public institutions. Furthermore, we will delve into regional and local realities, parallel initiative to THCS, and begin to reap the benefits of the projects funded in the first joint translational call launched in 2023 by analyzing their outcomes and ecosystem impact on the partnership's objectives and on the transformation of health and care systems. Research plays a key role in achieving this ambitious goal. Transformation requires knowledge, long-term vision, and the political will to maximize impact while simultaneously improving the use of often limited resources. There is a considerable potential for strategic learning across countries, and given the evolving nature of technological innovation, a significant opportunity to prospectively explore the effectiveness and consequences of different approaches in their settings, optimizing scarce resources. I thank all partners, work packages leaders, the European Commission and the coordination team for their tireless work and unwavering commitment throughout the challenging journey thus far. Continuous evaluation and monitoring will be necessary to measure the impact and effectiveness of research and innovation in healthcare. I wish you all a fruitful conference and look forward to next steps.
Great, thank you very much, and again sorry for on behalf of Mrs. Campitiello that couldn't be here today. We leave now the floor to Arjen van Hengel, who is the Deputy Head of Unit of DG RTD Unit D2 from the European Commission. Please, Mr. van Hengel, the floor is yours. Thank you very much.
Thank you very much, and good afternoon, everybody. So, dear guests, partners, colleagues, and It's a pleasure for me here to be here today with you on this event of the Transforming Health and Care Systems Partnership Annual Conference. So all of us share a common mission to ensure that the healthcare for the future and the healthcare that we're working on across Europe is of a high quality and is sustainable. I think that is really important, but with having the Transforming Health and Care Systems Partnership in place, we're in a perfect situation because we have now a tool to gear towards this goal. So, like this, we can foster a better and more innovative and truly transformative healthcare practices and systems throughout Europe. We all know that the healthcare sector today is facing an unprecedented challenges that impact all of us and all our member states. We're aging and our population is aging. By 2050, the people that are 65 years of older will account for almost 30% of our population. And with that, we experience a rise in chronic conditions. This trend will require increased resources, but also new approaches to deal with our healthcare management, spanning prevention, diagnosis, treatment, and long-term care. Another key issue is the healthcare accessibility and equity. So despite substantial progress that we've made already, the reality is that healthcare varies significantly across regions. We have underserved populations, and rural areas often experience problems and difficulties in timely accessing the healthcare systems. A WHO report recently found that a quarter of persons of 15 years and older reported unmet healthcare needs. And this is even worse if you're looking at the older population, where often daily healthcare is of the essence. So our healthcare workforce is our most valuable asset, but we face shortages. Shortages of healthcare professionals. This is one of the most pressing issues, with the estimated shortage of nearly 1 million healthcare workers in Europe. There is also a brain drain. We see that doctors and nurses move to other countries with better working conditions, better pay, which leaves some of our countries with shortages. Obviously, such shortages affect the quality and timeliness of care. Without significant action, we risk exacerbating this gap between healthcare services that are required and those that are available. Moreover, those shortages are also increasing the burden on the existing staff, with additional workload that comes to them. And that, of course, results into problems like burnout. The potential of digital tools that we have, artificial intelligence and data, hold a high promise for improvements in this area. But digitalization also requires infrastructures, policy coordination, and skills training, as well as the trust and confidence of patients. Finally, financial sustainability is a reality that we must face with open eyes. We need to transform our systems in a way that enables quality care without compromising the financial viability of our healthcare services. Addressing all these challenges demands collaboration and innovative solutions that align with our commitment to sustainable healthcare. This partnership has the potential to be a major game changer in this area, since it is uniquely positioned to address these challenges. The partnership is designed to mobilize efforts and drive innovations to help overcome obstacles in this area. It defines and prioritizes key healthcare challenges that most urgently need action. For this, it carefully assesses priority needs across member states, drawing on stakeholders' engagement and expert input. Having identified clear priorities, our focus must now shift to identifying truly transformative innovations that can directly tackle those challenges. We are delighted that the Transforming Health and Care Systems Partnership has made good progress to identify, classify, and promote examples of successful health and care ecosystems. 20 of these ecosystems across several member states have already been inventorized. Moreover, important lessons were drawn as to how such models can be emulated or adopted to be implemented elsewhere. Several of these lighthouse ecosystem examples were already presented during a recent workshop in Vienna. Such models rely on a common understanding of the problems, on a shared vision for change, and on shared accountability among our stakeholders. Building trust and long-term commitment are also part of the recipe, together with continuous learning, innovation, and improvement. Our aim is to identify and promote targeted innovations that bring real improvements to patients, to caregivers, and to the healthcare systems. But innovation itself is not enough. These innovations need to be rigorously tested with specific pilot programs to understand their effectiveness in various different and regional and national settings. Showing their effectiveness is great, but explaining how hurdles have overcome on their way to implement that is probably even more important. Especially since the next step is to support the adoption of such innovations across member states with different healthcare systems. Transformative ecosystems rely on enablers like resources, technology, a learning culture, and collaboration. We all know implementing change, especially at scale, is challenging. This requires effective policies, regulatory frameworks, and incentives. Therefore, this partnership has a crucial role to play in developing practical healthcare management tools, guidance, and frameworks adopted to the specific realities of different member states and their healthcare systems. We are glad to learn that the THCS Partnership is gradually becoming the main platform for sharing best practices among member states, enabling us to learn from each other's successes and setbacks. The sharing of knowledge and experience is invaluable, as it enables us to avoid duplication of efforts and accelerate the scaling up of successful initiatives. In this context, we are pleased to know that a new THCS Knowledge Hub is launched this month. This hub will become a major and user-friendly tool supporting our efforts to transform health and care systems. We expect that through activities like this, the partnership will significantly contribute to enhancing healthcare ecosystems across our member states. By aligning and coordinating resources and expertise, this partnership has a golden opportunity to make substantial improvements in healthcare systems and outcomes for millions of citizens across Europe. Now let's focus on how we can translate expectations into actionable plans. First, we encourage all partners to work together to define key challenge priority areas that should be the focus of our collective efforts. Healthcare digitization presents an opportunity to enhance the efficiency of healthcare practices. So in this context, the 2023 Joint Transnational Call funded several projects in this particular area aimed at leveraging and adopting digital tools and healthcare and health data approaches. The subsequent call in 2024 also supported digitization by funding projects aimed at developing innovative, person-centered health and care models addressing prevention strategies with the key of existing IT and digital technologies and services. These projects will provide evidence for digital health as a tool to make health and care services more efficient and agile. A key challenge is Europe's aging population and the associated rising prevalence of chronic conditions, as I already mentioned. Addressing this will require a robust community and primary care services. Those should be delivered to patients where they live. The partnership is actively working to tackle this challenge. For instance, the next transnational call will be launched in 2025 with a focus on the very important and strategic topic of strengthening and enhancing primary and community care services. The partnership can also play a key role in addressing the pressing issue of healthcare resource optimization and the need for rationalization. Reducing low-value care for improving healthcare efficiency is essential. That is essential to enhance patient outcomes and minimize resource wasting within our healthcare systems. This partnership can support initiatives and research aimed at identifying low-value care practices that offer minimal or no benefit to patients and that maybe even expose them to unnecessary risks. Clinical studies and research can also help us to identify more cost-effective ways of promoting and providing healthcare. The partnership funding must be directed towards projects that demonstrate not only scientific excellence, but also the potential for real-world application and scalability as well as transformation. The partnership should also develop a robust research funding and call plan that directly supports the identified priority areas. This will allow alignment with our strategic priorities and enable us to gather and feed the evidence, the data and insights that are needed to truly transform our healthcare systems. Addressing healthcare access and inequities is a critical challenge that must be tackled. Europe is culturally and socially rich as a continent, which implies that we have many different healthcare practices and many different levels of access. This provides ample opportunities to find inspiring examples of innovation within our member states. The partnership's effort to identify some 20 successful health and care ecosystem models, which can be adapted and emulated in other regions, represents a first significant step towards achieving greater equity in healthcare. But this is not enough. Creating forums, platforms, and mechanisms for knowledge sharing are other essential components to implement changes for the better. In this context, this new THCS Knowledge Hub will serve as a facilitator. We would like to see this Knowledge Hub developing into a knowledge platform of reference in the area. The Knowledge Hub should help identify and integrate relevant knowledge resources, enable and support capacity building, and facilitate knowledge sharing and community building initiatives. Finally, we must ensure that research findings, best practices, and innovative approaches are accessible to all stakeholders across Europe. The value of this cannot be overstated. When we share what we know and what our works, then we learn from each other's experiences. We build a stronger foundation for stronger and more sustainable healthcare ecosystems. In closing, I want to emphasize that the challenges before us are really very substantial, but our commitment to transform healthcare systems is strong. Through this partnership, we have a rare and powerful opportunity to create a real change for both current but also for future healthcare systems. It is all about ensuring that every individual across Europe has access to high quality, equitable and sustainable healthcare. This vision unites us, and only through collaboration, innovation, and we will have this shared purpose in mind, and we will make it possible to go towards achieving it. So thank you very much for your dedication, and I wish you a very fruitful meeting over the coming days.